Hi, and welcome to Mental Health Matters from CMHA, Windsor-Essex County Branch. I'm Jenny-Lee Almeida, and today we're going to be discussing when to start therapy when someone is experiencing mild to moderate symptoms of anxiety and depression. I have an amazing guest today, Patty Heath. She is from CMHA. She's a colleague of mine, and she is actually a therapist from the Counseling and Treatment Program. And she's going to actually shed a lot of light on the therapy process, and we're actually going to talk about what is CBT. Also, we're going to discuss when it is right. When is it time to start that therapy and that whole process? Sometimes navigating that mental health system, really daunting and scary. So 1 in 4 Canadians has depression. So these are statistics from Statistics Canada. 1 in 4 Canadians with depression serious enough to require treatment at some point in their life. So it is estimated by 2020 that depression will be the second most common health problem in the world. Although these may be alarming statistics, with proper treatment, depression and anxiety can be overcome. The most widely used treatments for anxiety are mental health counseling and medication. Research shows that these are equally effective at reducing anxiety symptoms, while mental health counseling has the advantage of treating the root of the anxiety, better preventing future reoccurrences of anxiety. I will shed some light with personal experience in regards to my diagnosis of panic disorder and generalized anxiety way back when I was like 18, 19, so a little older now. But I've done the process. I've done CBT. I've done therapy. I've done counseling. I've done medication. So I'm actually going to give some experience in regards to more of a personal experience from my standpoint. Patty is going to give us a lot of experience and shed light more in regards to what the CAT program is, counseling and treatment. And she's also going to talk a lot about what does that look like? What does therapy look like? So, thank you, Patty. I've known Patty for 10 years, and I think it was at a general all-staff meeting, she just received her 10-year pin. So, we are 10-year girls. High five for that. We have been at CMHA, and I think that tells a lot. It really does say a lot when you're at a place for 10 years. I was so happy when I got my 10-year pin. I was just oh my gosh. Yeah. I've been there for 10 years, and I actually am happy. I love where I am and what I do. So,
yeah.
Yay.
Yeah, we're lucky to be in a good spot.
Yeah, we are. So, Patty, can you tell us, what is the counseling and treatment program? Tell us, I remember I saw you, how long ago has the treatment program been going on?
Almost 3 years.
Yeah. I remember Patty, 3-4 years ago, she spent, an entire, summer. You were in an office, just reading books. She was doing so much research and prepping, and, you built this CAT program with obviously other colleagues at CMHA, but you guys did a phenomenal job, and it really has just done wonders for people in our community. So you want to tell people kind of about how it got started and why?
Yeah, totally. So it got started because it was an unmet need in the community.
Yep.
Through research and some experience looking at caseloads at CMHA, they realized that there were a lot of people that needed therapy, and case management wasn't the proper level of service for them. So people were in our services and they were still experiencing episodes of depression or anxiety, but they weren't, they didn't have the proper therapeutic treatment to be able to navigate those episodes on their own. So they ended up staying on caseload for a long time because when something would pop up, they would need support. So it came from identifying an unmet need. And then once we hit the ground and told people that we existed, we've just been flooded with a lot of
It's been
interest.
nonstop.
Yeah. Which really goes to show that it's something that Windsor and Essex County really needed.
Oh, yeah, huge.
So
I guess the question is that a lot of viewers are probably wondering, so what is CBT therapy? What is it exactly? And what's the whole basis? People are always like, everybody talks about CBT. What is it? And it's quite easy.
It's really interesting. So cognitive behavioral therapy is one of the few therapies that's actually been studied and proven to be effective with a variety of difficulties that people may face. But we specifically apply it to depression and anxiety. So it has some studies and some evidence backing its effectiveness. And what we do, we look at how our cognition, so how our thoughts, our automatic thoughts that just flood our mind, affect our emotions, and we look at how that in turn affects our behaviors. And then we look for some distortions, or we look for some unhealthy thought patterns, and see if we can look at it from a different perspective, a more healthier, more balanced perspective, in turn relieving distressing emotions, and in turn changing people's behaviors.
She said it right. So when I was experiencing those panic attacks initially at the university when I was about 18, 19, it's so true. Like the very first thing that happens is I started getting these thoughts and like I started getting physiological symptoms related to the panic. So like that heartbeat, and then all of a sudden this like out of body, I always call it the creepy crawly feeling when I get the panic attack, because so much is happening. But then the thought that starts to trigger right away is fear. So with that emotion of fear and like, oh no, it's like danger. What is going on to my body? I'm scared. So the action that actually happens is I started avoiding. I started panicking and stopping whatever I was doing in that minute, because I thought this is what's causing me panic. So you leave. And CBT, when you do that homework, it's really about finding, like, it really does. It's like that circle. One thing always is going to affect like behaviors, emotions, feelings, action.
And what you're describing when you're experiencing panic is really a natural physiological response that we have as humans. Humans that have kept us alive for all these years. It's that fight or flight response. So what's happening now for people that are struggling with anxiety and panic disorder is that response is overreacting or reacting to stimulus that they think is dangerous, but is in real life, in fact, it's not dangerous, but our body is just automatically interpreting it like that. So picture walking into the CAW center, the cafeteria full of students, and your whole body can start to react because of this trigger, think that it's a dangerous situation, need to escape. So we look at really normalizing that as well. We start with educating people that this is a normal physiological response. It's actually something that's protective. It's something that tells you when you're in a dangerous situation that you need to escape. So, how can we just experience some of that discomfort, knowing that we are safe, knowing that it will subside and it will go away.
Exactly. And like I always find like the first like 3 or 4 panic attacks that I had, you're still trying to process what's going on. So you're just like, I don't know what's happening. And then the tricky part is you actually start being fearful of having another panic attack. So that the anticipation is what then starts to trigger that cycle, that distortion, and like that action of actually, like, I remember sometimes just those thoughts of I'm so scared, I don't want to have another panic attack, would elicit a panic attack.
And you could be at home on the couch.
Anywhere.
Just thinking about
safe. Safe. Just start thinking. And it's when your mind just goes to that place.
And when you don't know what's happening to your body.
Scary!
Of course it's scary. People think they're dying. They're having a heart attack. They need to go to the hospital.
I went to the hospital like 3 or 4 times. To the triage, thinking I had a heart attack. And, I would be lying if I didn't say, like, I think that even, 5-6 years later, after I did some CBT and, I was getting some treatment, I will say that one time I don't know what happened. I started getting a panic attack. So my husband, funny enough, he's a therapist. So he's just like, okay, we're going to do some grounding. And he's trying to do that the whole therapy, right?
Mm-hmm.
You're safe, Jenny. Let's go for a walk. And we start walking outside. Guess where I'm walking to? The hospital.
Oh.
And he's laughing and he's like, Jenny, you're safe. But I'm like, I was just like, no, I need to go to the hospital. So it's still like, it's really hard. You have to always practice like that therapy of like being cognizant and mindful of the distortions and those thoughts.
It's like a muscle that you have to keep strong. You have to exercise. And although you had that episode, for some people it could really feel like a huge step backwards. It's a relapse. I'm going to panic again. It could really set people back. But if you look at the overall picture of the intensity of the episode, how long did it last? How frequent was it? It was one episode.
One episode.
Compared to years ago
when it was constant.
Constant, frequent, more intense. So when you look at that long-term kind of forecast of your health, it can help give people some perspective that, okay, this was just a bump in the road. I'm going to be okay.
And it does work because, you know, with therapy, I always tell people like you said, it's a muscle. You've got to strengthen it. I always, you know, tell people, you know, I had some foot surgery like 2 years ago. I had to do physio. Mm-hmm. I had to do some exercises. I had a regimen. I had to follow it for the best possible outcome. Mm-hmm. Now, with our mental health and with treating anxiety or depression, anything to do with our mental health, we also need to understand that we require exercise and homework. So we need to do the exact same thing that we would do for our physical health. It's no different.
Exactly. Yep.
So, take us through a therapy session. So, like, let's say it's the very first therapy session. Like, what does it look like? What do people expect?
Yeah, and I often ask people at the end, like, is there anything that you expected me to ask you about that I didn't ask you about? And they say, well, I didn't really expect anything. So it's good. It's good that you're asking me about this. The first session looks a little bit different than once we get into more structured therapy. The first session is about collecting some information, some more of a therapeutic assessment.
See where you're at.
See where you're at. Kinda. You know, what's changed, say, since intake, for example. But we also start to track your mood. So we use 2 rating scales, one that looks at depression and one that looks at symptoms of anxiety. And we have people complete that in session. And that's something that they complete at the beginning of each session.
Nice.
So we start to track your mood. We look at some of the problems, some of the roadblocks that you're experiencing. We assess for safety.
Yep.
Some people that are experiencing anxiety and depression also experience thoughts of death and thoughts of suicide. So we always assess for safety. And it's really just getting to know each other and getting...
building that therapeutic rapport.
Building that rapport, that comfort. A lot of the time people come in, they're almost shaking.
But you're nervous because you're just like, I don't know this person. Like, and they really don't know what to expect.
Yeah.
And that's scary.
We try to keep it light and you just tell me what's on your mind. Yeah. Tell me what's brought you here. And we start to kind of formulate a plan together. We talk about, at the end, if we have time, we talk about what their expectations would be for therapy, what are their therapeutic goals. If not, at the end of first session, the beginning of the second session, where we start to get into more structured. So we're always doing that mood check. We're setting an agenda for the appointment, and it's the client that's setting the agenda. I'm asking them, what do you want to make sure we talk about today? What's the most important thing to talk about? We always check in about what the homework was from last session.
Nice.
So how did that go? Any questions, any thoughts, any roadblocks, any success, and really highlight the success they experience. And then we go through the agenda topics. We do some problem solving. We use cognitive behavioral therapy, even just discussing, say they were triggered an episode of panic. So we look at, well, what triggered that? What were some of the thoughts that were flooding your mind? What were some of the physical symptoms you experienced? What did you do in that moment? What was your coping behavior? And start to look for any unhealthy or distorted thought patterns, introduce the idea that there's unhealthy, distorted thought patterns, and kind of get the ball rolling that way. But that's all specifically CBT, sometimes before we get into the structured, we usually have to start with some education. Like, what is anxiety? What is panic? What is what is depression? What's happening to my body? Maybe some behavioral activation. So for somebody that's experiencing depression, loss of interest in activities they enjoy, well, let's do some baby steps, some small activities, that they could enjoy. We look to get some symptom relief in the beginning, and it looks different for each person, but that's kind of a general path.
Cool. So when you said homework, I bet you viewers were like, what kind of homework? What are you doing? And I remember like one of my like first sessions at the U, like with a counselor, it was just like, here's some homework. I'm like, homework? I have midterms. I have exams coming and I'm getting homework?
Yeah.
So what does it look like?
Well, I joke with clients because we call it self-help assignments.
Oh, that's good. No, I like that.
And it is. It's a self-help assignment, but it's also work to do at home. So we talk about that right off the bat so that, again, they know what to expect. I tell people that they'll get out of the program what they put into the program. So the homework or the self-help assignment is always started in session. So, for example, somebody that's experiencing depression, we're talking about behavioral activation. We're doing that problem solving. We're making a plan for, say, going for a walk or doing some cardiovascular, doing some self-care at home. We're planning that all out in session, and then
you take it home.
Take it home, and then they've got to do some action. So,
so true.
In the beginning, like sometimes I just have clients just practice awareness of what their symptoms are, especially for people that don't have that insight about what anxiety is, which a lot of people don't. They just think maybe it's a personality trait or something's wrong with them, or that's just how I am. So even just tracking, let's look at your week. Tell me if you notice any changes in your emotions, if you experience any physical symptoms with that, and maybe what happened first. So just either keeping a mental note or a written log, and we start with that. So each assignment, we start in session. Each assignment is individual. I want to give a healthy push to people, but I'm not wanting to set people up for failure. So it's a mutual decision what that self-help assignment is, just so that I'm setting people up for success.
Cool. I know, and it really does work because I think a third or fourth session that I had, they started giving me like the CBT distortion work assignment where if I did have a panic attack or a racing thought, even just a racing thought, like, because I'm an all or nothing thinking. I was very catastrophic. It was just, if I saw a little bit of rain, I would say, oh my gosh, there's going to be like a bad thunderstorm. I won't be able to drive. Right? So it was just all or nothing. Yeah. So my homework was I had like worksheets where I had to write that thought, that statement. And I had to try, like I felt it was homework because you have to like challenge that all or nothing thought, that catastrophic thought and say, oh, okay.
What's the evidence?
What's the evidence that's supporting this? Nothing. And I found that when I started writing it out, it was visually there. And it was actually like making me feel a little better knowing like, oh, okay, so this is really not going to happen, the likelihood. Yeah. And that actually helped my anxiety a little bit more.
Yeah, I always encourage people when they're able to is to write this all out.
Yes.
It's concrete, it's black and white. You've assessed the thought and you've realized that it's distorted. You've challenged its distortion. Chances are it may pop up again.
Of course, it is going to.
But you've already done the work. So you can go, okay, it's raining. I've got this thought record. I've challenged this thought already. So it's kind of easier once you have a record of it. And I give everybody a therapy booklet, and I want them to keep everything in the same spot so that they don't lose track of the work that they've done.
That's awesome. And regards to like the tracking, like your mood and like what you did, I remember when they said, okay, you're gonna tell me what you did every day. I'm like, every day? And I just thought, well, no, why? I'm at school. They wanted to know my sleep.
Yeah.
How many hours of sleep I was getting. They wanted to know what I was eating.
Yeah.
They wanted to know how much caffeine, if I was smoking, if I was using, like if I was going out partying or having some wine or some alcohol. They wanted to know everything. And I was like, well, no, like, I don't understand. 2 weeks later, when I went in, I was reporting increased anxiety and panic on the days that I wasn't having more than 8 hours of sleep. And I was drinking 4 or 5 coffees a day.
Yes.
And that's what you talk about, like that insight. Yeah. You have to understand what anxiety is and what it isn't. So I can't have a lot of stimulant. I can't have that caffeine. The sleep.
The tea, the coffee, the pop.
Yes.
It creates that physiological response.
That's exactly it.
And then people think, oh, my heart's beating faster.
And then you freak out because you're having a panic attack.
Yes.
Done. That's to the T.
Yeah.
To the T, that's what happens.
And it's the same for people that experience depression. So we'll have them track a week of activities and rating their mood and their mood with the activity. And we can see patterns. Well, your mood was higher when you went out and spent some time with this friend, or your mood was higher when you took the dog for a walk, but your mood was lower when you were watching TV for 3 hours, say, or your mood was lower when you didn't eat a proper dinner that night. You had something, fast food to go. So it works both ways, where we can see some pretty interesting patterns.
But it's so funny because when you're doing it, like when I was personally doing it, you really don't see it. And I would tell a therapist, well, I was just having a good day. I didn't have a panic attack that day. But it really correlates, because even if you're taking the dog for a walk or you're outside or you're with friends, you might not understand that that is actually having a direct positive effect.
Oh, yeah.
But when you see it, like, it's visually there, it's concrete, it's actually helping your brain process, like, this is evidence.
Yeah. Yeah.
And that connection for me, I was like, oh, I see it. And I'm not saying that by any means is not, you're still going to have like a panic attack, maybe. You're still going to have bouts. Like, I always say for my anxiety and my panic attack, sometimes I find it's a yo-yo. And, but what I did in therapy and the homework, the base, has helped me, like Patty said, where if it is raining, I've already done that work. So I know in my brain, okay, that's okay. I'm going to drive safer. I have a plan.
Exactly.
So it doesn't mean that I'm not going to feel a little nervous or a little anxious, because that's normal. I've learned that is okay. It's my fight or flight response.
Yep. We, as humans, will never get rid of anxiety.
Never!
It's what makes us human. It's that innate physiological response.
Yeah.
So the goal in therapy is not to eliminate anxiety.
No.
It's to decrease the panic disorder,
yes,
the disordered symptoms. It's to decrease it, but it's also to teach people to be able to sit with those feelings.
Be okay with it.
And be okay with it. No, you'll survive.
Yeah. So, Patty, what about medication? Many people think that they have to choose either medication or therapy. And they don't, like, what do you think?
For people, I likened it to a pie with lots of pieces, right? Yeah. Medication is one piece. Therapy is one piece. Proper sleep is one piece. Proper nutrition is one piece. Having a support system is one piece. And it's really all of those pieces that creates a healthy individual. So some of my clients are on medication prescribed by their family doctors or prescribed by a specialist, their psychiatrist, and some aren't. It depends on the person. And sometimes people need medication for a short period of time, which in treatment could be, say, 6 months to a year.
Yeah.
In the big scheme of your life, that is a short period of time. It may feel like a long time, but sometimes people just require medication for a portion of their treatment. And then with therapy and with the other pieces of the pie and with their doctor's support, they can wean off of medication in the future. And it's very individual, and it really depends. Some people are scared of medication, But I've actually seen with the right combination, people really excel. It takes the edge off their symptoms so that the therapy work can be applied properly. They can experience success, that reduction of symptoms, and it further builds the individual's confidence to continue down that treatment path. So.
Thank you. The personal choice is this, like my personal experience, I'll be very honest, when the panic was so bad, I wasn't able to sleep. So it started disabling me in terms of things that I was doing in my life. Like I had finals, I was working, I had to commute to the U, it just too much. And I wasn't able to do anything. And I was so anti-medication. I was like, and again, it's that stigma regarding mental health. You think, what am I doing? Like, why don't I have this under control? You start to
people will say, why am I not strong enough?
Yes. Like I was so
strength.
upset with myself thinking like, why can't I just, snap out of it? Like, isn't that awful? But like, that's what I thought. And I was a psychology major, go figure, right? But it got to the point where it was so bad. And my first choice was, I want to go to therapy. Like right away, I was like, I need to go to therapy. Mm-hmm. I couldn't focus. So my very first 2 or 3 sessions, my thoughts were jumbled. Everything was racing. That when I left, I was great that 1 hour with my therapist. But then the minute I left, I was still not feeling well.
Yeah.
So I got to that point where I said, I'm open. I need to try. Like everybody's different, like you said.
Yeah.
So I had to take medication, and I loved how you said it took the edge off symptoms, because that's exactly what it did. I was able to sleep. The racing thoughts weren't 24 hours a day. I was still having anxiety, but it was almost like it didn't peak into a panic. Yeah. So it really did take the edge off. So then I could actually do homework. Like I could do the CBT. And for me, that was what worked for me. But also, no caffeine after 1 p.m. Going like sleeping 8 hours a day. Like I had a checklist.
A healthy routine, a healthy lifestyle.
It's consistency, routine.
One last piece about medication is it shouldn't be any different. So I'll say to people, if you had diabetes and you needed to take medication, an oral medication each day for your diabetes, would you look at it any differently? And they all say, no, of course, you'd have to take it for that.
Of course.
So it's just people, sometimes it can help to put it into perspective. Mental health, physical health, they're the same importance.
It's the exact same thing. But I think like initially what scared me is it's that stigma. It's that lingering stigma of what's wrong with me? Why am I different? I don't know why. Like with mental health, like with your symptoms, sometimes people can't see what's going on in your brain. It's all happening up here. So when somebody, when a doctor first said, we're going to put you on an antidepressant, that's going to reduce that anxiety. I was just like, what? Like, no, that's scary because you don't know what it's doing.
Yeah.
So it's really scary. So I always tell people like Patty said, do research, learn about what is going on with your body, advocate for yourself, and really know your symptoms, how you're feeling, and how you react to medications and symptoms and side effects. Advocate. Yeah. It's a process with like a circle of people, like a specialist, a family doctor, a therapist, and don't forget like family and friends, like to be there to just talk it out.
Yeah, those informal supports are invaluable.
Yeah, absolutely. So how can someone make the best use of counseling and treatment program at CMHA or any counseling they're receiving in the community? So you said already that you got to do like that work.
Yeah, you have to be invested.
You have to invest that time. Okay.
So it's when you start therapy, it's like taking a leap of faith, really. Yeah. You're meeting somebody new. You're trying something that you don't maybe know about or haven't experienced before. So you're already taking a bit of a leap of faith to get there. So I just say, continue taking that leap of faith. Be open to a different treatment for your symptoms. be open to applying the skills and the concepts and the techniques that you talk about in session, and also be open to giving feedback. So I ask my clients for feedback specifically each time about homework, how it went, like I said, roadblocks, successes, so that we can really create something that's personalized for them. Because I don't want somebody to leave and say, oh, CBT didn't work for me.
Yeah.
Well, maybe CBT wasn't personalized enough for you.
For you.
So it needs to be a personal approach. So people need to take a leap of faith, and with that leap of faith also comes action. So people have to take action beyond just the talk therapy in the hour.
Yep.
They have to apply it at home.
Homework.
Yeah, homework. Try your best.
No, but you really do. You have to, like I said, you just have to do that work.
Mm-hmm.
And at first, the first 2-3 weeks, you're just like, oh my gosh, like this isn't working. And then all of a sudden, I started to not have panic attacks every day. It went from like once a week, and then all of a sudden, once a month. And now, I still get it. And sometimes it's once every like 4 months or once every 6 months. But I know that, like you said, I don't view it as a setback. It's my flight response.
Yeah.
And I use that CBT and I ground myself, and I know like, okay, this is going to last for 2 minutes and I'm going to be okay.
Yeah.
And I have to go with that. Right.
Yeah.
So, tricky question. When would someone know that the treatment is working, and when is it time to finish?
Okay, so a short version of that is if it's working if you start to feel better.
Yeah.
But a more clinical look at it is if your symptoms start to reduce. So with those tracking sheets that we use, it's one tool that we use to check in on like the intensity, the frequency of symptoms. So the symptoms should start to reduce. Like you say, the panic attacks became less and less and less, right? So they should start to feel better. The symptoms should start to decrease. People should also feel more confident and more equipped to handle episodes of panic and depression. They'll have those tools. That's our job as doing CBT, is to teach people the tools to use themselves. So yeah, confidence, decrease in symptoms, they'll just feel better, really. Okay. So that's how you can tell.
So for the CAT program at CMHA, how long are they in therapy for?
So that it's an individual. It depends.
Right. But it varies.
Yeah, it varies. What you could expect typically is to start coming in once a week. So the sessions will be once a week in the beginning, and then as people get a chance to practice things at home, grasp some of the coping techniques, they've got to practice recognizing the distorted thoughts. We kind of have to let life happen, and it's a bit of an experiment for them to cope with things. So as they start to grasp those concepts, then we look at spacing it out. So now we're going to meet every 2 weeks, or we're going to meet every 3 weeks. And our program varies in how many sessions, but it's a maximum of 16 sessions.
But it's also, everyone's different.
Yeah.
Right? Like you said, like I remember I started once a week. And then all of a sudden it was like once every 2 months, I believe. And that was okay.
Yep. And that's good. That's progress.
That means that it's good. Like things are going okay.
Yeah. You don't need to go in as often because you're successfully navigating these episodes. So it is really a good sign. It's like they're graduating beyond needing that weekly support. And so sometimes I've had clients that have gotten to the 16 sessions and it's been a year. Wow. So it really depends.
It just depends. Now, one thing that's really cool about the counseling and treatment program that I thought that I actually didn't do when I was in CBT therapy is, in the brochure, it really does talk all about it. Please go on our website, windsor.cmha.ca, and you will actually be able to click on the CAT program and you can see all this. But something I really liked is, with the therapy, you guys also do offer like booster sessions.
Oh, yes.
And like education, like groups.
Yeah, so the booster sessions, that's something that's been studied and proven as part of a true CBT treatment. It's like going in for a booster shot.
I think it's awesome.
Yeah, so we do offer up to 3. We schedule one at a time at 3-month increments.
That's
so
cool.
3, 6, 9 months post-discharge. And what we do, we check in, how's life? How have you been applying your CBT techniques? What goals are you focusing on? And more of a bigger sense. Like, what do you want to focus on over the next 3 months? What do you see yourself accomplishing? And it's really, it's nice. It's fulfilling.
I was going to say that would be like so cool as a therapist to be able to see and check in with someone for like 3 booster sessions and like
see the real progress.
See the progress and see them there. Like, that would make me feel, it is fulfilling, right?
Yeah, it's nice, especially like you say, just because I see it so effective for people.
Yeah.
So it's fulfilling for me to just know that people are feeling better.
Yeah.
That's the booster sessions is offered for individual therapy sessions. The CBT group is something that we've just finished. Well, next week we'll finish our last session.
Yes, your last one.
And it is, it's a different stream. So we're looking at streamlining individual and group. So it's not that you'd be in both. The group is
one or the other.
One or the other. And group is 15 weeks of therapy. So it's just, comparable to 16 weeks of individual or 16 individual sessions. It's comparable to that. It's long-term treatment. It's a small group.
How many people would you say?
We started with 7 and we're finishing with 5. So we had 2 people, life circumstances changed and they weren't able to come, but we've got 5 that are finishing. That's cool. It's small on purpose. And I tell people that's how you know the difference if you're in a treatment group or a psychoeducational group. The educational groups are larger, they're classroom style. The smaller treatment groups are more individual focused. So we just week by week introduce a different part and piece of the cognitive behavioral therapy model. And then the end sessions look at more holistic treatment. We actually last week just did a yoga class.
Oh, that's awesome.
Had someone come in, we did yoga, we talk about nutrition, we talk about sleep hygiene,
everything,
healthy communication. So there's that holistic pieces of the pie. And within those 15 weeks, there's 3 individual sessions. So
that's nice.
It's a bit of a bit of both. So I meet with somebody individually in the beginning. We have half the sessions. We introduce a difficult personal topic, which is core beliefs.
Oh, okay.
And then I meet with everybody individually.
And to talk more about
to talk about their own unhealthy core beliefs. And then we have the remainder sessions. And then there's that final session at the end where we look at, okay, what's next for you? How did you do in this group? What's your next step in treatment or in life? And
that's really
it's a nice combination. Yeah.
Do you know what? Like right when you said like they're a group, I was like, oh, I don't know if that could be for me. Like right away, like my anxious brain, the automatic thought. But then the minute you said 5 people, I'm like, oh, I can make friends and like you connect with people. And like how amazing is that to be around a small group that, it's meeting somebody for the first time. You're going to feel nervous. You're going to be like, I don't know you. But then like as the sessions go, you actually are building rapport and relationships.
Yeah. It's so lovely to see. Yeah. They support each other, the group members. You can tell that there's a genuine
respect and care.
Yeah.
Love it.
Definitely.
Love it. So thank you so much, Patty,
Thanks for having me.
Answering my questions, talking a little bit more about the CAP program. It's an amazing program. You guys did amazing with this. And please visit our website. You can always call CMHA if you want any more information in regards to counseling and treatment program. And, for those also that, do have an EAP through your employer, please reach out if you are not feeling good and you're starting to, have increased stress and you're just not feeling good. Your gut's telling you like, hey, I'm having some symptoms that I'm not driving here. Like, I don't know what's going on. Talk to someone. It's so important. Like, please let it out and really talk. It's really, that's like the first step. Like just me openly saying, help me. I'm not doing good. Right. And
take that leap.
Yeah, it really is. So I think I don't have any more questions for Patty. Thank you so much.
Thank you for having me.
Today is December 13th. So we are very close to Christmas. Have a wonderful holiday season. Be safe. Lots of snow out there for the kids. So that's always fun. And for adults too. It's a good distraction to be like out in the nature. And, you know, if it's cold out, keep moving and you will not be cold. So we still have our Light the Way tree at Devonshire Mall, and that supports our bereavement and our GriefWorks program and the Client Assistant Funds. So please stop in. They are by...
I think it's the food court.
Yes, near the food court. Thank you. Oh, and Shoppers. Boathouse Shoppers.
Yeah.
Yes. So please stop in. You know, you can always get a ornament for $2. You can write the name of a loved one on that ornament and they will be on our trees. Also, if you need a stocking stuffer, there are some people that still have not done all their Christmas shopping. Have you?
I've not done all my Christmas shopping.
Really?
Not yet.
Oh.
Those socks are on my list.
Yeah, $15, great stocking stuffer, and always good for the people that you're like, what do I buy? Who doesn't need socks? We all need socks. So please check us out, and thank you for watching this episode, and goodbye.